Good afternoon, Bruce.
Well, nice to have you in our History on the World.
Yes, in the History Hall of Tweed, here we are with the chairman, CEO, and co-founder of
Topics and titles.
Canopy, Tweed, Spectrum. Can't keep up with it.
Yes, indeed. There's a lot going on.
Yeah?
Same thing at all.
Let me ask a personal question for myself.
Yeah.
And you could say me too. Not movement, just me too. Sleep.
Yes.
What do I want from Spectrum?
So we asked about 7,000 of our patients, why do you buy cannabis? What way do you consume
To turn my brain off.
And so second most popular reason people buy cannabis on a medical basis is to stay asleep or get to sleep.
Mm-hmm.
And those are two things called primary insomnia.
Primary insomnia.
You're not
Thank you very
sick.
much.
So sometimes what will happen is you have insomnia because you have a secondary illness. No, you just have primary insomnia.
Yeah.
And there's two types of insomnia. There are people who can't fall asleep and there are people who can't stay asleep. And so to fall asleep, what you need is a more rapid onset. So think of an inhalation, but we don't think smoking in bed's a good idea because it's been proven not to be.
Yeah.
But if you could actually have something you want, and what it'll be, we believe, is about a 1-to-1 ratio. One portion of CBD, one THC. And so we've got clinical trials.
What's one? Is it 50%?
50-50. So what we're starting.
What if you
to
don't
do-
like being stoned?
Well, you won't be, and you're going to sleep. And so what we're doing
Is it lucid dreaming?
if you're getting very colorful dreams, then the dosage is too strong for you. So we're
Someone
doing.
in here told me 6%.
Well, but it's a proportionality thing. So we're doing clinical trials starting in January,
Right.
registered with the federal government on the proper way. The second type of insomnia is to stay asleep. And so
Right.
if you wake up, I can fall asleep. I'm a terrific faller sleeper. The staying asleep thing, not so good.
You said you get up at 4 in the morning.
Well, no,
check your
I
paperwork.
get up, usually it's 2:45, and I walk around and do my little patrol and close people's doors and do stuff. And the reason is, that's called sleep-based anxiety. And so people get it because, I get it less because we have more money in the company now. When you're in charge of the company, you're in charge of people getting paid. If you start running low on
More
money,
or less.
well, I think about other people not getting paid and that would be bothersome to them. So when you wake up with sleep-based anxiety, what happens is you can control your mind all day.
Yeah.
But when you fall asleep and you're asleep for 3 or 4 or 5 hours, then all of a sudden the little gremlin gets out and he starts running around.
Is that what it is?
And so that's what it is. And so what we
Yeah.
want to do is manage both of those
That's good
symptoms.
branding.
Because-
Little gremlin.
Well, what happens is if you fall asleep and get a good sleep, or if I stay asleep, the effectiveness of me or you the next day is higher.
Mm-hmm.
And if we can do it in a way that doesn't leave you feeling dopey, like, Ambien has had a long run, but not a good run.
Never tried it.
Well, it knocks you out, but the problem is, and depending your age, it may or may not metabolize through and make you feel alert early or not. So getting to sleep is fine, staying asleep is fine, being awake and smart doesn't work out really well.
What's the first one? You said that was the second most medicinal.
So pain,
one.
but pain's a very broad, so you can have all kinds of pains. You may have gone through a cancer treatment, you all of a sudden end up with some kind of, a tingling, a manipulation of your hands, and you say, well, that's my type of pain. And the next person may have been hit by a car, a totally different thing. Somebody else might have, rheumatoid arthritis, which can transmit into all kinds of different types of pain. So pain isn't a pain, it's so wide spectrum.
I'm going to give you a huge shout out for Canopy.
Good.
There's a fellow that I buy dog food from. Cat food.
They're very similar.
And he's had a major car accident. He's been on morphine
Yeah.
daily. He switched to cannabis, and his pain is gone, and his alertness is up. The guy is from morphine?
Yeah. Well,
You can replace morphine?
So I think there's a bunch. We're doing about a $2.5 million funding of a program at UBC, which is how do we wean people off of opioid addiction.
Yeah.
So there's that off-ramp creation. The second part, though, is if we can actually begin to use combinations of cannabinoids and other ingredients so that you never get prescribed opioids.
Right.
The chance of getting addicted if you don't get prescribed falls to 0. So why don't you start to think about how do we manage as a first-line pain treatment for many circumstances cannabinoids instead of opioids?
Well, how are you going to manage the pharmaceuticals, which is the largest industry in the world? What are they going to try now that they are feeling jealous of your growth?
Well, so this.
What are they going to do? What's their check move?
What they do is what they always do, which is they watch until they see value and then they pay a lot.
I saw something that they were trying to bioengineer a synthetic.
Yeah, synthetics will get to synthetics in time. But what they'll do is, I think probably at the end of 2019 or beginning of 2020, the thematic will be, and here are the pharmaceutical players. Because they're just so much
And
bigger.
you'll be in the lineup or you'll out of the lineup?
We'll work with them. We'll have a lot more IP by then. But
Right.
they're gigantic, as you mentioned. So what they can do is afford to pay. Right? Their idea big has another zero on most corporations.
Bruce, are you going to be here for the rest of your life, or are you eyeing another, do you have another dream developing, like a hamburger chain?
No, really the biggest problem I have right now is I'm worried that in the rest of my life,
You're worried?
there will be nothing more active, interesting, or exciting as this.
Yeah, I agree.
And so my big worry isn't what next, but the rest of it's boring.
Yeah.
So you want to make this ride as long as you can, because prohibition of things of this magnitude, this is not even once in a generation.
So that's good news. You're not going away tomorrow.
No. And I think right now I'm probably the only person who can fire me, and I have no intention of firing me.
Because we like you. Smith Falls likes you. The region likes you. We want you to stick
Hang out
around.
with me, the novelty wear off. But it is, if you really...
I haven't heard that yet.
If you think about what is happening, this is the biggest global event. This is way bigger, like, prohibition. There was prohibition in America. They were still drinking quite a bit in Europe.
Yeah.
So prohibition wasn't as big.
But you're not like Al Capone, though. So.
No, but if you think about magnitude events, the Berlin Wall falling was a pretty big deal, but it really only kept two countries apart.
Yeah.
And it had a little bit of a political, philosophical thing that was indicated there, but this is actually bigger than any of those events. And it's happening, in a sense, faster than all of them.
Well, I did a story the other day on the approval, the mindset of Canadians. I went through a whole bunch of surveys, and 26% of Canadians approve of, never mind medicinal, recreational. 26% approve of recreational cannabis. That's good news at this time.
I think if you actually say how many are neutral or support, we're well over 68%. And the reason is, anybody who's fundamentally opposed to the governance of cannabis must be in the illegal operation business of cannabis. Because we're not introducing anything.
Right.
What we're doing is saying, do you really prefer that criminals generate all the product, all the profits, sell it to whoever the hell they want with no consequences? Or do you prefer that it be educated, regulated, and monetized by a government?
Yeah.
And so, like, it is such an obvious choice to me that I think if anybody's opposed, I just say, whoa, time out.
Yeah.
I can tell you that within 15 minutes of anywhere in Canada, you can buy illegal product.
Yeah. No, I agree. I totally see that, and that's the four seeds that people are trying to grow out of their home, but they have no idea that it's not going to be the same product.
And no, the best news about that is it should come with a Tweed coupon saying, when this screws up, which it invariably will, you can come back and get a better deal.
That is a really good finish.
Thank you.
I know you got to run. People are chasing you for your time. Thank you so much for your time for the Wedge.
No problem. Glad it was here.
Bruce Linton, the man of the year, I think.
Okay, thank you. See you. Bye.